All right, so Dr. Longbow has already told us that yes, we have to brush our baby teeth. What about brushing or cleaning the gums? The teeth come in little by little. For me, they've been going away little by little. But anyway, for the child, coming in little by little. So there's a lot of gum in there, not just teeth. Do we need to clean, brush, wipe the gums?
Yes, we do, because bacteria can cling to anything. So it doesn't have to be on your teeth. It could cling on the gums, definitely. And it's also important to clean the gums so that we stimulate the growth of the baby teeth. So sometimes they're just below the gum, and then we can see that the gum is starting to blanch, to become white. And if you clean the gums, you're stimulating that area. And it makes it more comfortable for the eruption of the baby teeth. And also that way, we're sort of teaching our babies the feel of having something in their mouth, and then it makes the transition much more smooth when the teeth come out and we start brushing. So the basis of prevention is simply to remove what doesn't belong there. So
all right, now let me sneak a personal question in here. My 10-week-old grandson, and I'm seeing two little white spots here. Is that the teeth underneath, basically? Is that what I'm starting to see?
And if you're cleaning the gums, you may.
I'm not yet, but I'm going to do that. I have to make sure my daughter. You are watching this one, right, Liz? You want to make sure you watch this video, okay? So be sure to clean that, because yes, we have to brush and clean the gums.
Yeah, and even if there's bacteria on the gums and it doesn't cause any harm, but it's a habit, and we're being consistent, so that way the baby understands that they learn by feeling as well. So if all their lives they've had somebody go in there and clean, then later on when it's more relevant and more important when all the baby teeth are there, and then you go in there. It's not such a trauma for your child, and they're used to it already.
Good point.
Right?
So, Dr. Julie, you're not just a dentist, you're a mom, and you've been through this with your own kids. How did the kids start to react when you're trying to do this very early dental hygiene work with your own children? I mean,
it could differ. They could either just welcome it or just fight it. It's easier to, if they fight it without teeth, it's easier for you.
They can't bite your finger yet.
They can still bite.
They can gum your finger.
You'd be surprised. My son didn't have any teeth until
it still hurt.
10 months, and until then he used to eat everything with his gums. So they can still bite, but it doesn't hurt as much. But again, just treating them slowly, and again, it's just staying tuned to what's going on with the body. The same way that when you have a young child, you look and make sure everything's okay with the body. In general, make sure the skin's okay. Well, the mouth is part of the body as well. Mm-hmm. So just make that habit of cleaning the mouth, just keeping things healthy, clean as possible.
Have you ever come across strategies that help make it more enjoyable? I mean, that make it both more enjoyable for mom and the child, to make it into a fun experience, or is there a way to do that?
Well, again, it shouldn't take very long, right? You just
it's pretty quick.
It's pretty quick. You just take a cloth and make sure you wash your hands, keep your hands clean. Take a clean baby cloth, wrap it around your finger, and kind of just wipe around the gums. Have a look at the mouth and see if there's anything you may have concern with. If you do, then speak with your doctor or your dentist, and we can certainly have a look at it. But it's just staying tuned and aware of what's going on in the body.
So part of it is that it actually helps you be a good observer. You're taking the time to actually, yes, you're cleaning, but you're also catching things early that you can then report to the dentist.
And that's like spending time with your baby too. The same way, you tickle them, you hold them. So it's just a very fast, procedure to do.
So you're making it part of the routine. Of daily life.
They'll get used to it. Some people may be better than others, but when they're young, it's much easier.
Yeah, better than trying to start at teenage years or something like that.